Honorable colleagues, I rise today in support of Bill S-280, an act respecting a national framework on sickle cell disease. Thank you to my colleague, Senator Meiji, for giving us a comprehensive overview of sickle cell disease. We are privileged to have had her medical expertise to inform the Chamber about the complex medical details and challenges of this hereditary disease impacting descendants of Africa, the Caribbean, the Middle East, South America, and certain regions in India and the Mediterranean. I would also like to thank my colleague, Senator Cordy, for being a champion of this issue for so many years, including her work in 2017 to have Sickle Cell Disease Awareness Day recognized. I want to thank and recognize the work of the Honorable Tony Ince, MLA of Cole Harbour, who presented and supported Bill number 396, an act to establish Sickle Cell Awareness Day in November 2023 in my home province of Nova Scotia. June 19th will now be observed as Sickle Cell Awareness Day in Nova Scotia. I support Bill S-280 and urge that it be sent to committee to be studied as soon as possible. Sickle cell disease impacts people living at particularly vulnerable intersection, the intersection of race and disability. Daily life being so significantly impacted by the forces of racism and ableism, I believe this framework has a particularly important role in improving the lives of Black people with sickle cell disease. This intersection is the result of systemic issues and policy gaps. It requires policy solutions like this framework. I agree with the importance of creating a national research network to improve training and diagnostic tools, setting evidence-based national standards, creating equitable neonatal screening, public awareness campaigns, and a tax credit for families. Members of my extended family and kinship group have been impacted by sickle cell anemia. For many years, African Nova Scotians suffered in silence because this chronic illness was considered a taboo topic, one you didn't talk about anywhere to anyone. I am grateful for the leadership of people like Dr. Josephine Otoa, which began when she was a graduate nursing student. She had the courage to take a stand. And Rugi Jallo, who has led the volunteer work in Nova Scotia and across Canada on this issue. Their efforts have helped to raise awareness, have helped to reduce stigma, and have helped to create policy changes. Now, colleagues, it is time to broaden the scope of this work nationally. Bill S-280 positions us to do that. In 2013, the Nova Scotia government announced the introduction of the Maritime Newborn Screening Program. Dr. Josephine Otoa, who was, as I said earlier, a graduate nursing student, was instrumental in bringing the sickle cell screening of newborns to Nova Scotia. The ability to screen babies as early as possible saves lives. It means that young babies can access life-saving treatments early, preventing irreversible damage, reducing future hospitalizations, and preventing serious symptoms from developing. Dr. Otoa studies racism in health systems, and through her research, she identified the issue with a lack of screening for sickle cell disease. This early screening program is an excellent working example of race equity in the health system, a test that in mainstream medical systems may not seem to make a remarkable change for most children, has the power to make a significant change specifically for Black families and other racialized families whose quality of life would be improved with the knowledge of an early diagnosis. Essentially, colleagues, This is an example of bringing a culturally responsive lens to healthcare systems. I consulted with ASHE, Community Foundation for Black Canadians with Disabilities, who stated that they are in support of Bill S-280 in principle, due to the capacity the bill has to improve the lives of Black people with this chronic illness. They recommend that the bill explicitly recognize the intersectionality of race and disability and how anti-Black racism impacts health outcomes and access to support and care. They also suggest that the bill explicitly recommend the framework include culturally responsive training for healthcare professionals. They stated, and I quote, "Bill S-280 represents a crucial step towards recognizing and addressing the unique challenges Black Canadians face with sickle cell disease," end quote. When this bill goes to committee, I encourage you to invite Dr. Atoa and the ASHE Community Foundation as witnesses. You will be enlightened. The Sickle Cell Disease Association of Canada recently sent out a newsletter, and in it, the founder and CEO, Ruki Jallo, recounted an interaction they had when they asked a person with sickle cell disease how they were doing. And their response was, and I quote, "It hurts to breathe, but hey, I'm glad to be alive," end quote. They shared that this person was unable to attend the semester, the entire semester at university due to multiple hospitalizations, even with the usual educational accommodations that were offered. I share this person's story to highlight how sickle cell disease can prevent people from access to education and subsequently meaningful employment. Honorable colleagues, for a person with sickle cell disease, the impact touches every area of their life, and a framework addressing this disease has the capacity to change lives for Black Canadians who live with sickle cell anemia. I believe their lives are worth it. I urge you to see the importance of supporting Bill S-280, and I look forward to the committee work our colleagues will do to examine the whole impact of this proposed framework. Asante. Thank you.